I'm Taylor Mikesell. I'm a physical therapist with Innovative Physical Therapy and John Getz Physical Therapy. And today we have the pleasure of talking with Dr. Sara Sohn with Confident Pelvic Rehab. You want to just say hello for us?
Hi, yes. Hi, everyone. So I'm Sara Sohn. I am a pelvic floor physical therapist here in Jacksonville Beach with my own little practice as well. And I love, love, love this topic. We're going to talk today a little bit about pelvic health, sexual wellness, and I'm so excited to have you here and listening and learn a little bit more about your body and some of the intimate ways it's connected to the things that you're getting great help with for at John Getz Physical Therapy.
Thank you so much. My name is Summer. I'm the marketing coordinator at Innovative Physical Therapy and John Getz Physical Therapy. Thank you so much for having us on our Zoom today. We're just going to lead into basically her discussion, and then we'll just ask some questions as we go on. So would you like to start?
Sure. So, we are all experts in the body, but a lot of people don't even know what we're talking about when we say pelvic floor or pelvic health. So I'd like to start there, just like, what is a pelvic floor? What is pelvic floor physical therapy? How could that be related to some of the work and some of the things that you all are doing for different orthopedic injuries, and answer any questions in that regard? Does that sound good?
Yeah, sounds great.
Cool. So I'll talk about it, just like I'm talking to anybody, because I don't know how else to say that, but I know that we're all know a lot about this stuff. So the pelvic floor is really those muscles, just like any other muscle in your body, but I always say in an inconvenient space, that are supporting your whole body. I'm going to show a little picture here because it just will make life a little easier. But if you're looking at a pelvis, can you all see this picture?
Yes.
Awesome. Okay. So if you're looking at a pelvis, now all genders have this, okay? So what you're looking at is, it's going to get a little dark here, but imagine someone was kind of chopped in half and you looked into the bowl, right? And you're looking at all the muscles that are supporting the body. Right. So if you imagine, here's the pelvic floor. On top of this, we have all these organs. And the next muscle we have is the diaphragm. So here we have the spine, here we have the hips, and it's all interconnected. So oftentimes people will say, well, I'm having some concerns with my back. I'm having some hip pain. And when you start to ask some questions around their pelvic floor, you start to see like, oh, wait, that's when you started to leak urine, when you laugh, cough, sneeze, jump. That's when you started to have pain with insertion. That's when you felt this dull ache right in the scrotum, and how these things are all connected. So just as like an example of a client that I saw, a lot of people assume with pelvic floor health that it's like, oh, after you have a baby. And of course that's true, right? Like after someone has a baby, maybe 6 weeks after, we want to be checking all of these muscles. But oftentimes I'll see, for example, a triathlete, and they've been sitting on a bike seat that's been sitting right on one of these nerves here in their pelvis. And now they're having this pain every time that they have sex. Or now they are experiencing some like running to the bathroom when they didn't experience that before. And they're having to like press the gas on their way home to go pee in time and things like that.
Mm-hmm.
They're really intimate concerns that are connected to all the other aspects of our body. And that's what the pelvic floor is, and what pelvic floor therapists help people with, is how this is all connected in these like more intimate problems and muscles.
I think what's interesting, right, is we refer to the pelvis as more of the base of support, right? So it's really your connection from your feet that touch the floor into your back. So when we have patients that have a lot of back pain, we always start at the pelvis, because if the pelvis is dysfunctional, if it's not moving the way that it's supposed to, or if the muscles aren't there to help support it, then it leads a lot into lower back pain, hip pain, like you said, glute pain, all these things that people have, whether it's walking, whether it's sitting, whether it's getting up and down out of a chair, any of those things really like kind of drives it home for us. But also the one thing big with the pelvic floor muscles is if you've been doing a lot of core strengthening and your pelvic floor muscles is kind of like, if you think about a balloon, I don't know, this is the way we describe it, right? If you think about a balloon, like you need the top and the bottom to be anchored. So we talk about the diaphragm being able to work, but if the pelvic floor muscles aren't working at the bottom, then that lumbar core muscles don't have anything to grab onto. So you could be strengthening your core for the end of time, right? And
Mhm.
never quite get strong enough to help protect your back because your pelvic floor could be an issue. So this is where we like to give people all the information. Um, but it's funny because a lot of patients come in and they say, "Oh, we've got back pain." And then we start looking at their pelvis and they go, "That's not where it hurts." Right? That's not where I'm having the issues. But then you fix the pelvis and they go, "Oh, my back pain's gone."
Mhm.
So it's very interesting from a perspective, from our perspective. Um, and we could do a lot of that external stuff,
Mhm.
but a lot of the internal stuff we like to refer out depending on what the problem is, right? And what the issue may be. So that's why, one of the reasons why we like to talk to people like you, because you have a much better insight into those areas. Whereas we say, oh, you have to strengthen your pelvic floor muscles. And we know how to do it, but we don't have the expertise that you do. So it works out well.
Well, I'm so honored to be, one of your referrals resources because, just as like a personal share, I had really as a physical therapist, when you have an injury, it feels like, oh man, I should not have this injury. I should be able to fix this real quick. And I had my own personal back pain. I never understood how distracting it would be. I never understood how it would change my personality. I started not being able to exercise, do the things that I love. And I went to John Getz physical therapy a little bit before I had to have some spine surgery and afterwards. And it was really helpful. And that's also when I really saw, even though I learned theoretically, okay, now I'm actually starting to have pain. I was having pain with insertion based type sexual activity. I was leaking a little bit of urine when I laughed, coughed, sneezed, and jumped. And I never experienced any of that before until my body basically was saying, all alarm bells are on and we are not gonna be using these pelvic floor muscles because it hurts.
Yeah. Yeah.
So just having that experience, if you're listening and it feels vulnerable to even talk about, it feels like, oh, I just wish that this would go away. Just like, I get it. I've never had that experience. It was humbling to say the least of being a physical therapist, working in this space, and then going 2 years, I really struggled. And now I can confidently say it will get better. So if you're listening to this and you just need that little bit of hope, it will get better. There will be an end. And yeah, you're in the right place.
Yeah. There you go. Right. I guess my question then, Sarah, would be like, from what is like your ideal patient? Like what is someone that who are you really looking to target?
Yeah,
Who do
great
you want to
question.
help?
So there's a few misconceptions that I wanna say here. So one is the idea that everyone needs some form of Kegels or pelvic floor strengthening, and it's so not the truth. So when we think of muscles just like any other muscles in our body, sometimes people need to be strengthening those muscles, but oftentimes there's an issue with that pressure chamber, like you were saying, and like more functional based, or even hypertonicity, meaning like the muscles are having a hard time resting. That's especially the case when I see people with things like urinary urgency or pain. And so I'll say an ideal client is someone that's having one of these intimate concerns. I see all genders. I'm one of the only pelvic floor physical therapists that's very comfortable seeing all genders between men, women, transitioning, and I have a subspecialty in pelvic pain disorders. So although I love to treat people that have things like incontinence, some pressure down there, prolapse, maybe they're pregnant, postpartum. In many countries around the world, it's standard of care to see someone like me 6 weeks after having a baby just to check your pelvic floor. I have a special place in my heart, especially for people that are experiencing pelvic pain. So these are things like pain with sexuality, endometriosis, hysterectomy, and those type of things, or in conjunction with someone that's experiencing hip or low back pain and needing a little bit of that internal work as well to understand like that complete picture and really, work in that complete way, along with the physical therapist that you're seeing in orthopedic settings.
Yeah, I think it's great when you show the picture, right? When we talk about like internal versus external stuff. There's few things we do, but the coccyx is what we would call a keystone structure in our in what we do. And the reason why that is because sometimes the neural system attaches to the coccyx and the nerves can get so fired up just from a rotated or deviated or a coccyx that's not positioned appropriately, if it's too flexed or too extended. And like those are all fancy words to basically say like we've worked on people's coccyx before and we've fixed neck pain. So like it just goes to show you how important that whole pelvic floor, the whole pelvis, the whole system can be. And it's not just there for back pain or for pain with sexual activity or pain with going to the bathroom or having a hard time going to the bathroom. Like it really is, like we say, kind of our base of support. So if we're not, I mean, that's the word we like to use, but if we're really not addressing, if you're going to physical therapy and you've got back pain and it doesn't seem like it's getting better, and they're not addressing your pelvis, then there's a problem. Because what I find more than anything else is people that have back pain, they don't even know how to move their pelvis, right? They don't know how to get that pelvic mobility so that their spine can move the way that it's supposed to, because it is designed to, if we look at it, right, it is designed to bend forward and backwards and twist and rotate and go side to side. But if we can't move from this area in here, then we're never going to get the motion that we need. And it's just going to increase stress and it increases stress in the joints. It increases a lot of the problems in that area and it breaks down those tissues. So the like arthritis pandemic, right? All of the pandemic, such a bad word to use nowadays, but like the whole arthritis epidemic, the issues that we're having, people talk about disc degeneration and all these things. If you get ahead of it early, the risk is relatively low unless something drastic happens. But if you don't know how to move your pelvis, this is why, I can take anyone, any age group, but where we really, our bread and butter is like people in their 40s and 50s, and as they're starting to get older and as they start to stiffen up, we really want to get them moving from their pelvis and from their spine appropriately and efficiently so that we don't lead to those issues like you talked about, hypertonicity of your pelvic floor, all of those things. Like when those joints stick, those muscles tighten up, and then it makes it so much harder to take care of it. So that can be anything, like I said, pain with walking, pain with standing, pain with getting up and down off the floor, playing with their grandkids. Those really where we kind of like we really succeed. And if you've been going through therapy and you're not getting your, again, just to reiterate, if the pelvis is not being involved, it's not really therapy that's going to be beneficial for your back for a long sustained period of time.
Yeah, no, thank you for saying that. It's such a great point. I want to show real quick just like this image because I think it really piggybacks on what you were saying. Like, this is like the sagittal image of the spine and then the sacrum, and you can see that the nerves coming from the spine innervating into this pelvic floor and into your hip, and how this is the tailbone here, and how you're moving this tailbone affects all of this stuff, right? Like people are always talking about that piriformis muscle. Oh, like my butt hurts. It hurts right here in my butt.
Yeah.
And here it is, like, right? Like here's our piriformis muscle, here's our pelvic floor, here's the obturator internus or that hip muscle and how it's all connected. And you can really see, you don't need a degree in biokinesiology to understand that if you move this and by doing some different things in your pelvis, you're going to affect all of these muscles, all of these nerves, and probably feel so much better. And there really is, I always say I don't have a magical finger. I really believe in the work that I do. I think it's so important to be seeing what's going on. A lot of people are intimidated and scared. We don't use any metal or stirrups. I always say that your OB will be inserting a speculum, moving the muscles out of the way, or a urologist is checking the prostate. I'm not doing any of that. I'm just looking at the muscles. It's just my finger. But with that said, I don't have a magical finger. So there's so much that can happen all on the outside by taking a look at how these muscles are moving, by doing different movements with the tailbone, with the spine. And so although I am so welcoming and would love to help anyone that needs help, especially if you aren't, just having, I don't even want to say if you're not seeing improvement, but if you're seeing improvement and you also want to be working on your pelvic floor as well and understand how those are connected. But there's so much that you can be doing that it sounds like, you're really already getting that care from the outside as well, that it is all connected in that way.
I realized that pelvic floor, I mean, like the way you guys break it down and explain, like, I mean, from just like people who are not like in the know about this, I feel like this is just like a subject that's just popped up recently. Like if you weren't like postpartum or struggling with like endometriosis, like you were saying, like it wasn't discussed or talked about until you went to like a physician. But even then, like it still takes time to realize like, oh, I didn't realize my pelvic floor was the whole problem to begin with. Is there any like things that people can do to like help strengthen in their pelvic floor that they can do at home as well?
Yeah. So again, I want to reiterate the idea that not everyone needs to be strengthening their pelvic floor. In fact, a lot of people will be having the tension in their pelvic floor and actually need to learn how to fully rest their pelvic floor. So one of the best things that you can do for your pelvic floor is get comfy with it. And what I mean by get comfy with it is a mirror. So if you have a mirror, and regardless of your anatomy, and let's say if you're somebody with a penis and you are raising your scrotum and lowering your scrotum, can you use that muscle? If you're someone with a vulva, can you look down there and look at the area between the vaginal opening and the anal opening and see that area moving? Can you make it contract? Can you make it rest? Can you get more comfortable looking at your own anatomy? If there's some blocks there, if doing that is painful, if you try to do that and you're leaking urine, when you laugh, cough, sneeze, jump, yell at your kids, you can't exercise, then I really recommend working with someone one-on-one. If you're already having these kind of symptoms. But just preventatively for anyone is just getting really familiar with where your pelvic floor is, unshaming, looking at that area of your body, using those muscles and seeing like, okay, what happens when I do this exercise and I actually fully rest that muscle? What happens when I do this exercise and I fully contract that muscle? It'll be like the booster, like the sonic boom booster to all of the work that you're already probably doing. Even singers, I just did a whole lecture over the weekend with a bunch of singers about using their pelvic floor to produce like more sound, like there's so much that goes into it that can really be helpful in so many ways. So just looking at it, getting familiar with where it is and how you can fully contract and fully rest it is a really great starting place.
I think that's great because a lot of people don't know where they don't move, right? Like I'll take someone that comes in and they've got neck pain, and I'll go, turn your head to the left, and they'll turn their head and they'll go all the way to the left, and I'll go, okay, turn your head to the right, and they'll go. I'm like, that's it, and they're like, what do you mean that's it? And you can see clearly like one side moves more than the other, but they don't recognize that. So when you say get comfy with it, I think that's a great way to put it because we really don't know which muscles we're using, or we don't know where we lack mobility unless either A, somebody tells us, or B, we feel it, right? And a lot of people that are in pain just don't move into pain, so they don't feel it. And if nobody tells them something looks weird, then they don't understand what's going on either. So I think getting comfy with it and looking at that is a great way to put it.
Thank you. I always say, I have all the fancy stuff, the biofeedback, the NMES, whatever. But my favorite and most powerful pelvic health tool is a mirror, honestly, that everyone can go get for $1. And this is so much easier said than done, right? Because there is a lot of conditioning that looking at this part of our body is really scary. And so if that feels overwhelming to you, I do recommend working with someone that has a little bit more of a trauma-informed background. I think I mentioned in my case in particular, I'm a pelvic floor physical therapist, but I also went back to school for sex counseling and sex education because I saw a need of how important it was to really be able to help like a whole person, just like you all do. And oftentimes things come up when we try to look at this area of the body, talk about this area of the body. So know if that's you, that is normal and that's okay. For a lot of people, just looking down there does produce this sense of anxiety, but it's one of the most helpful things that you can do to like relearn, how it moves and see how it's moving. And also sometimes it's like unlearning a lot of things. Like people will have a baby and they'll have a perennial tear and they're so afraid to look down there because they think that it looks so different, all these things. And half of my job is showing them like, look, it looks great.
Yeah.
Things are looking so much better. And now you can think about that part of your body and you can connect to it again because it's not as scary as you thought.
Yeah, I think that's great. It definitely is always good to give good news, right?
Mm-hmm.
So I guess we'll give you a little plug here, right? As far as how do they get a hold of you? If they want to talk with you one-on-one, what's your process? What do you go through?
Sure. So good news, I am so close. Like literally I could sneeze from my office and be at your all's office. So I am right down the road. All of my appointments, because I do help people such intimate things, are one-on-one with me. They're between 1 or 2 hours, depending on what's going on. And the best start is you can go to my website. It's confidentpelvicrehab.com, or you can Google Confident Pelvic Rehab and send me a text message. I'm very approachable. And we can book a phone call. So a phone call with me is $40. I can chat with you one-on-one about your own body, about that process, see if working with me is a good fit, and we can schedule that first 2-hour appointment if it is the best fit for you, because I do have some other options as well. So yeah, going to my website or sending me a text message at confidentpelvicrehab.com is probably the best way to connect and work in collaboration with you and your team, and also have a great relationship, where I think working as a team with your other providers is so important so that we can all be helping you together.
Yeah, I agree. It's never just one thing, right? Like I feel like a lot of it should be teamwork and to help get through all that stuff. And then just, is it cash only, insurance?
Yeah, so I don't take any insurance. All of my appointments, like I said, are one-on-one with me between 1 and 2 hours. However, I can do super bills, which is a fancy word for a receipt it's like a fancy receipt that says what we did, why we did it. And if you have out-of-network benefits, you might get reimbursed. I also do payment plans for people that are needing some form of payment plan, but I don't take any insurance at my location at the current moment of this recording.
Okay. All right. Is there any way you want to close? Do you have a quick one-liner that would help people close?
Ooh,
Put
putting
you
me on the spot
there.
here.
Put you on the spot there, huh?
Just thank you. Thank you for being brave and listening to this. If you took this time, I think it takes a lot of bravery to even be talking around pelvic health, sexual wellness, to be thinking about ways that you can improve your health and your low back pain. Even if you've seen a lot of times people have been struggling with things for a long time, and just to have that hope and that bravery of asking that one question, stepping into that one talk and taking a listen. I just want to thank you. Thank you for your bravery and for listening and being here.
Well, thank you for joining us, Sarah. I can tell you're so passionate about what you do, and thank you for sharing that just common knowledge and like how we can get comfortable with ourselves. We really appreciate it.
I loved it. And if your audience ends up loving this and having more questions, I would love to come back and I can do a talk on anything that you all want to talk about. This is super fun for me. I am passionate about it. So
Yeah, we enjoy it. Thank you so much for joining us. And then yeah, we'll look forward to doing some stuff in the future.
Yeah,
thank
me
you.
too.